Hello students, instructor Hannah here for chapter 1, lesson 1.2. This is the types of medical records. So you have either a paper-based patient record, where most of the record is on paper. Some data might be stored on the computer, such as the registration information, but this is where the patient has a physical chart. Or you have the electronic medical record, where the entire medical record is stored in a database on the computer and there is no paper chart. Any paper records are scanned and added to the electronic medical record and then typically shredded. So the EMR, electronic medical record, is the most common form of record now. This is the computerized record of any health information regarding the patient, which includes care of the individual and the progress of patient's condition. The entire record is stored on a database. Sometimes you'll hear it referred to as the EHR, electronic health record. So you could hear it referred to as EMR or EHR. And the software can perform the following medical record functions: creation, storage, organization, editing, and retrieval of records. So the advantages are speed and productivity, quick retrieval of information, documents from outside facilities can be stored, no filing required, saves time and space, paper costs are reduced. Okay, so I've worked for the Palo Alto Medical Foundation in Santa Cruz for quite a long time now, before it was Palo Alto Medical Foundation. And we had a whole building full of charts, medical records building, entire warehouse full of our patient charts. So when we integrated to the electronic medical record, it took a long time to put all that information, scan all of those charts into the electronic health record. But once done, we were able to dispose of the charts after 7 years. And now that building houses the call center. So lots and lots of people sit there and answer the phones and send messages and schedule your appointments. So definitely more effective. So the efficiency, it includes checkboxes and drop-down lists. You can print customized education handouts and instructions for the patients, and you can also now electronically send new prescriptions and refills directly to the pharmacies. Accessibility, this means that the medical record can be available at any computer station and more than one person can view it at the same time. And it's accessible immediately if the patient calls the office. So back in the old days when we had patient charts, we would have to fight over who got the chart, especially if the patient had an appointment with one provider one day and another the next day. We'd have to try and figure out how to share it and transfer it. And then if the patient calls into the office with questions about their medical record, if that chart was in another location, then you weren't able to assist the patient. So disadvantages is that there's an initial cost that is a large financial investment, including purchase of hardware and software, and then software upgrades. The time investment, as I talked about, is considerable. Learning and using the system and on-site training and tech support, and it can take several months or longer, as well as transferring all those records into the electronic record, as I talked about earlier. Old records need to be manually scanned into the computer. That is a large job. So when we're talking about the health history, it usually is sectioned into these following: identification data. So this will include basic demographic info about the patient, such as their name, address, and date of birth. It should include the chief complaint, the present illness, the past history, family history, social history, review of systems, and then also a physical exam. So this is typically known as the health and physical. The chief complaint. So there are 2 parts to a full chief complaint. That's the main reason that the patient is there seeking care at that reason that you're here today. What is the reason for your visit? Why are you seeking care? And this is used as a foundation for the patient's present illness. And the MA is usually responsible for obtaining and recording the chief complaint. It can be entered on a pre-printed form, like a progress note, or directly into the EMR. And certain guidelines must be followed in recording. So the guidelines are, you want to use open-ended questions. Okay, so that means that is a question that cannot be answered with yes or no. Okay, so examples of that would be, what seems to be the problem? What are we seeing you for today? How can we help you today? Okay, closed-ended questions are things like, so I heard document the chief complaint concisely and briefly. You're going to use the patient's own words as much as possible, right? And include the duration of the symptom. So the onset, when did it onset? So you want to avoid using names of diseases or diagnostic terms. So if the patient says they have a nosebleed, you're going to write nosebleed, not epistasis, which would be the medical term for it. Right. Classic. I thought it might help you if I listed my symptoms. That's a long list. I've seen those before. So when we're recording chief complaints, correct examples would be burning urination that has lasted for 2 days, pain in the right shoulder that started 2 weeks ago, shortness of breath for the past month. Incorrect examples, has not felt well for the last 2 weeks. So that's very vague, right? Has not felt well. Well, that could mean a lot of different things to a lot of different people. So it's not specific. Ear pain and fever. Well, that's great. You just need to specify which ear, or if it's both, bilateral. And then you need to know how long both of these symptoms have been going on. You need the duration. Pain upon urination, indicative of a urinary tract infection. So again, we don't want to use the disease names. Okay, we don't want to pre-diagnose the patient. That is out of our scope of practice, right? And the duration is not listed. The present illness. This is an expansion of the chief complaint. So this is a full description of patient's current illness from the time of onset. This should be recorded on the same form as the chief complaint. Sometimes the medical assistant completes this. You're going to ask the patient more detailed questions to obtain a description of the chief complaint. And this does require skill and practice, learning how to ask the proper questions to obtain the correct information. Past history. This is the past medical status of the patient and past diagnosis. This assists the provider in providing optimal care. Typically, the patient completes this section, and it's usually in a checklist form, and the medical assistant can definitely assist if needed. Sometimes patients don't know exactly what medical diagnostic terms mean, and you need to put it in layman's terms for them. So the past history would include any major illness, childhood diseases, unusual infections, accidents and injuries, hospitalizations and operations, previous medical tests, immunizations, allergies, and what did that one last? Current medications. Yeah. Family history. Typically the patient would complete this section, or they could verbally tell the medical assistant or the provider. And this is a review of health status of the patient's blood relatives. So parents, siblings, grandparents, aunts, uncles. This focuses on familial diseases, which is a disease that occurs in blood relatives more frequently than would be expected by chance. So examples of that would be cancer, heart disease, allergies, diabetes. So that's important information to have regarding your patient. Okay, so on each blood relative, it would include the state of their health, the presence of any significant disease, and if deceased, what was the cause of death. The social history, that includes information on a patient's lifestyle, such as health habits and living environment. And the purpose of that is because lifestyle may and can have an impact on a patient's condition. And if a major lifestyle change is necessary, support services might be recommended, such as smoking cessation. The social history should include the patient's education, occupation, both past and present, their living environment, their diet, their exercise, sleep patterns, any use of tobacco, alcohol, caffeine, recreational drugs, and that includes past and present, their sexual history, their personal history, and travel to foreign countries can be pertinent. The review of systems. This is a systematic review of each body system. The purpose is to detect any symptoms that have not yet been revealed. The provider typically completes this section, or you may give a checklist to the patient to complete. And it has a series of detailed and direct questions related to each body system. This assists the provider in determining the type and extent of physical exam required. Documenting in the medical record. Documenting is the process of recording information about a patient in the medical record. This is performed by personnel directly involved with the healthcare of the patient. This is a legal document, again, so it's very important to chart information completely and accurately. You want to write it right. Check the name on the record before making an entry, and check the date of birth as well, because you will have patients, you know, John Smith, you could have quite a few John Smiths that are your patients. So you need to check the date of birth as well. And this is the best protection from professional liability and malpractice lawsuits, is good care and good documentation. If it wasn't documented, it wasn't done. This is so true. So if a procedure is excluded from the correct patient's record, from a legal standpoint, a procedure not documented was never performed. So medical treatments, procedures, and medications administered should be documented right away, immediately. Do not wait until later to chart. Do it and then chart it. Documentation guidelines. Check the name on the record before making an entry and date of birth. Include the date and time on all entries. Document accurately using clear and concise phrases. Be brief but complete. Avoid vagueness and duplication of information. You do not need to include the patient's name in entry. Begin each phrase with a capital letter and end with a period. Use standard abbreviations, medical terms, and symbols. This saves time and space, but first check your office policy for accepted terms. Spell correctly, use a dictionary if necessary. Document immediately after performing the procedure. If you delay, you may not remember certain aspects of the procedure. Never document in advance. And the individual performing the procedure should be the one documenting it. You're never going to document for somebody else. Okay, these are huge. So you're never going to document that you gave an injection before you do it, because what'll happen is you'll walk in there and the patient will say, I changed my mind, and walk out, and you might forget that you already documented that. And it's difficult to delete it from the medical record. So you don't ever want to have any falsities or inaccuracies in that patient's chart. That includes documenting for somebody else. And you might have a staff member say, oh, I totally forgot to put this in. Could you just chart this for me really quick? I gave this injection. I'm so busy. Never, never do that. When you're documenting in a paper record, always use black ink. This provides a permanent record and it's less hard to reproduce. Make sure you write legibly, include the date and time on all entries, begin each new entry on a separate line and do not leave any blank space. Each entry is signed by the person entering it. You're going to include your first initial, full last name, and credentials. So Lori would sign hers L. Columbani. Comma, CMA. When you are charting here in the program, you will chart the first initial of your name, period, your last name, comma, and we will use SMA for student medical assistant as your credentials. Never ever erase, black out, or use whiteout on an entry. This reduces the credibility if involved in legal litigation. So it's pretty hard to justify the use of that in the court of law. Make sure you correct all errors using the proper method. To correct an error, you're going to draw a single line through the incorrect information because you need the information below it to remain legible, to show that you're not trying to hide anything. You're going to write the word error or ERR above the incorrect data, and you're going to include the date, first initial, last name, and credentials, and then insert the correct information next to the error. So here's an example. You have the date and time, Manto TB test, measurement, 10 millimeters. So Lori must have written that incorrectly and realized that it was actually 12 millimeters. So she puts a single line through the incorrect information, writes error, the date, and her initials, and then the correct information. Okay. Symptoms. Symptom is any change in the body or its functioning that indicates the presence of disease. So we have two types of symptoms, subjective and objective. Subjective is felt by the patient and cannot be observed by another person. So this could be nausea, pain, vertigo, pruritus, which is itching. So I try to remember that the subject, which is the patient, is the only one feeling the subjective symptom. Objective symptoms can be observed by another person, such as fever, we can test for that, right? Rash, coughing, cyanosis, which is a bluish tinge. So that's all things that we can see on the patient. So I like to remember objective can be observed. Documenting the patient's symptoms. The MA should have a thorough knowledge and be able to recognize common symptoms. And taking the patient's symptoms consists of obtaining the chief complaint and then getting additional information about the chief complaint. The MA takes the patient's symptoms during office visits and during phone conversations. Information obtained over the phone often determines if a patient needs to be seen in the office or in the emergency department, and that helps determine the immediacy of treatment needed. Other activities that need to be documented. Procedures performed on the patient, such as vital signs. So it will also be collection of data. Administration of medications or vaccines. Specimen collection and sending out to the lab. Diagnostic procedures and laboratory tests. So if the patient does not undergo the test ordered, documented proof exists that the test was ordered. And this also refreshes the provider's memory that a test was ordered. It would include lab test results and any patient instructions given to the patient. So an MA may need to give instructions to the patient regarding medical care, such as wound care. It is very important to chart this information. A pre-printed instruction sheet may be used. Patient signs the form indicating that they have read and understand the instructions. The MA witnesses the signature. The original is filed in the chart and a copy is given to the patient. This legally protects the provider if the patient does not follow the instruction and causes harm to themselves. Other areas of documenting would be missed or canceled appointments, telephone calls from the patients, medication refills, and changes in medication dosage by the provider. And the best way to become great at documenting is to practice, practice, practice. Thank you. See you next time.